Mm. So, good evening, everyone. I'm Dr. Scott Mesh of Los Ninos Services, the Executive Director, and I'm very, very pleased to welcome you to this evening. And I want to start off by thanking the Department of Health, specifically the Assistant Commissioner, Ms. Marina Yogel, for beginning the dialogue about the need to provide more information to folks working in the field about COVID, including the latest research, vaccine information, and CDC information, and so forth. And then I really greatly appreciate the enthusiasm that Dr. Amler has, the Commissioner of the Westchester County Department of Health, to facilitate this program, and Dr. Hewlett, Head of Infectious Diseases, who will be our main presenter about the topic tonight. So I will turn it over to Dr. Amler, who will then introduce Dr. Hewlett, who will then have a short presentation, and then we'll open it up to questions. You can provide the questions through the Q&A feature. Just type your questions there. And our goal is to answer all of your questions in the best way possible. And we have up till 6 p.m. If needed. Without further ado, thank you so much for your enthusiasm, Dr. Amler.
Well, thank you. It's my pleasure to join with you tonight and your staff, the Los Ninos staff. And with me tonight, as you said, I have Marina Yogel, who heads our early intervention preschool program. I have Dr. Dow Hewlett, who is an infectious disease physician who works for the health department. And I also, I'm joining you, and my background is in pediatrics and disaster medicine. So I just want to thank you for the opportunity for Dr. Hewlett and me to join you on this town hall on COVID. I know that it's been 21 months of nonstop COVID news, and we are all just very, very weary of it. I'm tired of it too, and I wish I could tell you that the problem has been resolved and it's all over, but unfortunately it isn't over. And now we have a very powerful variant, which is a mutation, a strain of COVID-19 called the Delta variant, that we all need to take very, very seriously. So if you forget everything else from today's talk, if you could please just remember this: vaccination against COVID-19 is our best road to recovery from this pandemic. So if you haven't already done so, please go get your COVID vaccine. And if you have family members that have difficulty getting to a clinic, offer to give them a lift. Take them for their vaccine. The vaccine offers us all the best protection, not just for you, but for your family members, your co-workers, and for our community here in Westchester. And Westchester has done a really excellent job of getting vaccine. We have, in some age brackets, more than 80% of people in that age bracket vaccinated. And let's not forget, your vaccine protects the children that you care for, because they're too young to be vaccinated. And many of them are at increased risk for complications of COVID because of underlying medical conditions that they may have. So Dr. Hewlett is going to get into the science of all this with you shortly. But you need to know that the Delta variant, CDC is saying it's about twice as transmissible as the earlier variations of this virus. In fact, it is very, very effective at replicating itself. And the Delta variant makes anyone who carries it more infectious early on. And they may not even be aware that they have the virus. They may not yet be feeling sick, but they may still be infectious. And this makes it very hard for healthcare professionals to catch up. So the virus spreads even further, infecting more people. And that's why Delta is the dominant strain and the source of more than 80% of the COVID infections in the United States right now. So you should know that this virus is different than last year. It's not the same form of COVID that we were dealing with at the onset. And so a lot of times people say, well, I had COVID early on, and all I had was like a mild cold, and I really didn't feel that bad, and it's nothing to worry about. But there's no guarantees if you get the Delta variant that you're going to have the same clinical outcourse that you had, a clinical outcome that you had with the earlier version of this virus. And there have been several studies, in fact, 2 studies, and I don't know, Dr. Hewlett may cover some of these, that have showed that patients with the Delta variant were more likely to be hospitalized or have serious outcomes, including death, than those caused by the earlier strain of COVID. So today's COVID vaccine should not be taken lightly. It's serious, and if you're not vaccinated, it could leave you on a ventilator and even kill you. And in regions where COVID vaccination rates are low, the Delta variant is sending scores of young people to the hospitals, where many of them, unfortunately, end up on ventilators and because of an inability to really get, to breathe properly. Some of them may not even survive. So according to the CDC, the hospitalization rates for children are 4 times higher in the states with the lowest vaccination rates compared to the states with the highest vaccination rates. And I would really encourage you to look it up for yourself. And that's what's happening in Louisiana, Arkansas, Texas, and Florida. And I've lived in most of those states. So I'm really sad to hear what's going on. But unfortunately, in these states in the lower part of our country, in the southern part of our country, their vaccination rates are incredibly low. In some communities, like 30%. But you don't have to travel to these places to be at risk. The Delta variant can find you, unfortunately, right here in Westchester. Our COVID-19 case counts have been trending up since June. On Monday, 9/13, we had 2,330 active cases of COVID in Westchester County. That was 156 new confirmed cases and a positivity rate of 2.7%. Today, our case count was 174. And, I would just hate for any of you to become one of our statistics. So instead, I'm here today to urge you to get the COVID vaccine. Please don't wait any longer. Don't wait until it's too late. You don't want to become seriously ill. And you also don't want to pass this virus to a friend, a family member, a student that might be in your care, somebody whose immune system isn't strong enough to fight it off and who may not be eligible to receive the vaccine. In short, the best weapon we have against COVID is the vaccine. And we need to get as many people as possible vaccinated. And once they are initially vaccinated, we may be offering boosters later in the month of September. So if you've had 2 doses of Moderna or Pfizer, or you've had a dose of Johnson & Johnson, stay attuned because, there may be further boosters on the way. We're waiting to hear what they're wanting us to do. And that's why I'm here to urge all of you to get your family, your grandparents, your unvaccinated children in your family and in your classroom, and urge everyone to get vaccinated, to do it right away. And we are here at the Health Department in Westchester to help you do that. In fact, we're happy to give you a COVID vaccine for free at our clinics. And all you have to do is show up at our White Plains Clinic at 134 Court on Fridays, anytime between 10 a.m. and 1 p.m. You do not need an appointment. There is no charge. And at our Yonkers Clinic at 20 South Broadway, on Mondays and Thursdays from 4 p.m. to 7 p.m. Again, no appointment needed, and there's no charge. You just don't want to gamble with this variant or the next variant, because there undoubtedly will be another variant. This virus continues to mutate, and who knows what the next variant is going to look like. So we would encourage you, I'll even plead with you if that's what it takes, to get you to come by and get your vaccine. And so I'm going to turn this over to Dr. Hewlett. I'll stick around in case there are questions later. We're happy to talk. Thank you.
Thank you, Dr. Amler, and good evening to all of you. It's certainly an honor to be able to speak with you and to have a conversation with you about COVID and about the COVID vaccines. And so I'm going to share my screen here, and I hope that this presentation will be interesting for you. Sorry that we can't all be in the same room. I'm going to get onto slideshow here. Okay, so this is essentially a town hall discussion, and as Dr. Amler and Dr. Mesh were mentioning earlier, please submit your questions through the chat or through the Q&A, and we'll be happy to answer your questions at the end of this presentation. So this is going to be an overview of some of the aspects of COVID, some of which Dr. Amler already covered, and then we also will be speaking specifically about the vaccine and posing a few questions to you. And at the end of the presentation, we're going to talk about some of the myths that have been floating around concerning the COVID vaccine. Now, we know that there are a range of things that can happen clinically as far as COVID is concerned. And individuals may be just asymptomatic. It's almost like sometimes a very simple or mild symptoms can occur, but many people are asymptomatic and they can still transmit the infection. But the most common manifestations are mild symptoms, a cold-like illness. Transmission of the infection begins about 2 days before the onset of the symptoms, and the maximum risk of transmission is between the 2 days before the onset of symptoms and to around day 4 or 5 after symptom onset. Now, a small percentage of people go on to develop moderate to severe illness. These individuals may have fever and cough and shortness of breath. Some will have chest discomfort. Some will actually have stomach problems, gastrointestinal problems, and some will develop vascular problems. And one of the things that's been found recently is that COVID actually is a disease of the blood vessels. It actually affects the blood vessels all over the body, although the thing that we hear about most with COVID is the pulmonary or the lung manifestations and the pneumonia. It's important for us to know also that in addition to the acute manifestations of COVID, we have some individuals who we call the long COVID or long hauler syndrome. And it's estimated that anywhere between 10 to 30% of people will develop this. And people have developed things like brain fog, difficulty concentrating. There can be other types of complications like muscle aches and respiratory complaints. And it's important to realize that one of the things that's one of the reasons why we want to get vaccinated is that we can prevent these long-term symptoms from occurring. And it's not only about just preventing the short-term types of things that we see here. Now, this disease, I think you're all familiar. COVID most commonly spreads during close contact. So people who are within 6 feet of a person with COVID-19 or who have direct contact with that person are at greatest risk. Infections occur mainly through exposure of the respiratory droplets. These respiratory droplets cause infections when they're inhaled or deposited on mucous membranes like those that line our mouths and our noses. And spread from touching surfaces is not thought to be a common way that COVID-19 spreads. And we've learned a lot over the last year. Now, vaccines are extremely important, and where would we be without them? And this is Dr. Edward Jenner back in the 1700s. And he, of course, was the person who invented and developed the smallpox vaccine. And it's estimated that smallpox vaccine saved hundreds of thousands, if not millions of lives during Dr. Jenner's time. And we now have the luxury of having many diseases which can be totally prevented if we accept vaccines. And all of the diseases on this list, polio, whooping cough, measles, mumps, chickenpox, all of these disorders, hepatitis, diphtheria, and tetanus, they all can be essentially prevented if we are vaccinated. And one of the reasons why many of us have never seen the diseases on this list is because people have been vaccinated. But what happens when we stop vaccinating against these common diseases, these vaccine preventable diseases, we see outbreaks of vaccine preventable disease, as we saw back in 2019 with over 285 cases of the measles right here in the New York area. In California, back in 2010, people decided they didn't want their children to be vaccinated, and there were over 9,000 cases of the whooping cough, and 10 infants died during that outbreak. In Rockland County, New York, right here again, we had outbreaks of the mumps. So this is what happens when we decide that we don't want to vaccinate any longer. Now, the currently available COVID-19 vaccines, there are 3 of them. The Moderna vaccine is an mRNA vaccine. The Pfizer BioNTech vaccine is an mRNA vaccine. Both of these vaccines are highly effective, and they are both administered in 2 doses. The Moderna vaccine, 28 days apart, and the Pfizer vaccine, at least 21 days apart. And then there's the Johnson & Johnson or Janssen vaccine. And that vaccine is what we call a viral vector vaccine, and that vaccine is administered as a single dose. All 3 of these vaccines have been proven to be effective, probably over 90% effective in preventing serious illness, hospitalization, and death, and they are all safe. And all 3 of these vaccines, as we mentioned, are over 90% effective in preventing these 3 things: serious illness, hospitalization, and death. Now, a little bit about herd immunity. You might find this to be fascinating, but this is an important concept, and a lot of people have had some questions about herd immunity. And what can we say about this? And so I think for you as people who are involved with education of children and also educating ourselves, herd immunity and what we call the R0 are concepts that have been around for a long time, even before we had COVID. And this particular symbol, the R0, represents the basic reproduction number of a communicable infectious disease such as COVID-19. This R0 represents the average number of people that an infected person is likely to infect. At the beginning of the COVID-19 pandemic, the R0 was estimated to be 2. And Dr. Amler already mentioned to you that when the Delta variant came along, this actually changed. Now, if we say that we have an R0 that is at 2, that means that for every infected person, they would on average pass infection on to 2 others, and the infection would grow wildly. For influenza, this R0 is also around 2. For the measles, it's actually 12. And you might say, well, if it's 12 for the measles, and that means that one person gives it to 12 people, well, then why doesn't everyone have the measles? Well, the reason why is because just about everyone is immune to the measles, either because they were exposed to the measles and had the measles as children because they are over the age of 50, or because they received the measles vaccine, which has been a requirement in order to go to school. And these calculations are based on the assumption that all in the population are susceptible. Now, this is what Dr. Amler was referring to, the Delta variant. The Delta variant is more easily transmitted, and it is more than twice as transmissible as the original strain. And the R0 for the Delta variant is now approximately 5. So here's the original situation with an R0 of 2, 1 person infected, giving it to 2 other individuals. Here's what we're dealing with now. Over the last couple of months, the Delta variant, where 1 person can give it to as many as 5 others. And we know that the way for us to deal with this is to protect ourselves and our families and others with the vaccine. And I should mention also the R0 increases the percentage of the population that's required to achieve herd immunity. And one of the things that we commonly have to deal with and that we hear about is, well, at the beginning they said the R0 was only 60%, or the herd immunity was only 60%. And now you're telling us it's 80 or 90%. Well, this number changes as this R0 increases, then the percentage required for herd immunity also increases. And that's why it is higher now than it was originally estimated. Now, a lot of unvaccinated people will say, I'll wait and see. Well, here's what happens when we fail to reach herd immunity. And the question is, have we seen enough? Mississippi hospital system was on the verge of collapse in mid-August. Dozens in Texas, dozens of Texas hospitals were out of ICU beds back in the middle of August. Hospitals were overwhelmed with unvaccinated patients. This was felt to be an outbreak and a surge of the unvaccinated. Hospitalization rates for children, as Dr. Amler was mentioning, are soaring nationally. This is according to the New York Times just a few days ago. More children are hospitalized with COVID-19, and the doctors fear that it's going to be getting worse. This is from the Wall Street Journal just 2 weeks ago. Over 4.4 million children tested positive for COVID since the beginning of the pandemic. Over 121,000 new cases were added during the past week. This was back in August the 12th. And so the question is, we want to wait and see. Well, this is what has happened because we failed to reach herd immunity when we had the opportunity to reach it. And I guess the question now is, have we seen enough, or do we still have to see more of these dire consequences? Now, cases have been increasing in children. Since July, the American Academy of Pediatrics has been going through this, and they've been noting, and this was reported in CNN just a couple of days ago, that cases have risen exponentially among children in the US since July, according to data that was published Monday by the Academy of Pediatrics. They reported 243,373 new cases among children over the past week, and this represented a 240% increase since early July, when kids accounted for 71,726 cases. After a decline in the early summer, child cases have increased exponentially with nearly 500,000 cases in the past 2 weeks. 500,000. The latest update comes as the schools across the country are in full swing, and experts have advised adults to get vaccinated so that they can protect children under 12 who are not eligible for vaccine. So one of the things we have to keep in mind here is that it's not only about us, those of us who can get the vaccination, and those of us who may be making the choice about, well, I don't want it, but also your decision is impacting children who have essentially no way to protect themselves. So I'll end the presentation by going through a few myths, and we'll try to talk about the facts. Those of us who are in a senior or seasoned age group know who this gentleman is, and his name is Sergeant Joe Friday. Sergeant Joe Friday was the star of a television series called The Dragnet, and this was his favorite line when he was going in to investigate a crime or a homicide, and he would say, he just wants the facts, just the facts. So we're just going to try to give you some of the facts as we close up here. First myth that we hear about is, I already had COVID, so I won't benefit from the vaccine. Well, this is false. The COVID vaccines are recommended for persons who have previously recovered from COVID. It's recommended that ideally individuals who have COVID should wait about 90 days after recovery before taking the vaccines. The measured immune responses following the vaccine are up to 4 times the response that we see with natural infection. And so you have a greater level of protection that is afforded to you by the vaccine. And the other thing that has been shown is that the Delta variant actually can occur and is more likely to occur in people who have previously had COVID because their natural immunity does not protect them from the Delta strain. Another myth that we often hear is that since the survival rate is so high, that is the 2% mortality, so that means that 98% survive. Since that's so high, I don't need a vaccine. Well, that also is kind of false reasoning. Although the survival rate for COVID-19 is 98%, between 10 to 40% of impacted persons develop the long symptomatology, long haulers, or long COVID, as we call it. Long-term complications can be debilitating. There are a lot of other complications that occur in individuals as they're recovering from COVID, such as coagulation or clotting disorders. And these place individuals at risk for heart attacks, for strokes, and for neurologic disorders, including loss of taste, loss of smell, and chronic fatigue. And recently, erectile dysfunction has been reported as a complication of COVID. Now, one of the things we hear most commonly is COVID causes sterility, and so I don't want to take the COVID vaccine because I want to have children. And this is a false myth. Again, this myth was perpetuated on the internet. It was claimed that the vaccine spike protein cross-reacts with another protein called syncytin 1, and that protein is an important component in placental formation. The COVID vaccines do not contain syncytin 1 protein or mRNA encoding for syncytin 1. These vaccine spike protein and the syncytin 1 are very different from each other. So there is absolutely no evidence that the vaccine response creates cross-reacting antibodies to syncytin 1. Recently, in the headlines, one of the celebrities was talking about not wanting to take the vaccine or not advising to take the COVID vaccine because it would cause impotence. Well, there's no evidence that COVID vaccines cause impotence. The fact is that back in May, it was found in a study that was published in the World Journal of Men's Health that those who had COVID-19 were actually 5.6 times more likely to have erectile dysfunction. And those who had erectile dysfunction were over 5.2 times more likely to have had COVID. And this was reported in May of this year. Men now have one more compelling reason to get a COVID-19 vaccine. And doctors suspect that the new coronavirus could make it hard to perform in the bedroom. So I think that this is another thing that we can add to the list of reasons why one should consider the vaccine or reconsider it if one is deciding that they don't want to have it. So in summary, all three of the COVID-19 vaccines are safe and effective. I have taken it, and all of the people in my immediate family have taken it. My 4 adult children have taken it, and my 1 grandchild who is old enough to take it has had the vaccine. My 3 younger grandchildren are not yet old enough to have it, so they're relying upon us for their safety. And I've urged all of my friends and all of my colleagues and all of my relatives to take the vaccine as well. What we should keep in mind is that when you accept vaccination against a communicable disease like COVID, it protects you and those around you in the herd, such as children who cannot be vaccinated and those who have weakened immune systems, as Dr. Amler was discussing earlier. So the people in your family who might have cancer or people who might have inflammatory disorders who have to be treated with immunosuppressing drugs, people with diseases like lupus and other connective tissue disorders like rheumatoid arthritis, those people need to be protected. When a level of herd immunity is reached, the virus has few susceptible hosts and the pandemic will come under control. When vaccination levels remain low, the virus has the opportunity to do the following things. It can adapt through mutations, and one of the prime examples is the Delta variant. If the vaccination levels are low, the virus can become more easily transmitted, with rates of infection increasing logarithmically, and that's exactly what we've been seeing in various parts of the United States, as Dr. Amler mentioned, the southern United States in places like Florida and Texas. And this can overwhelm the health system as we see in areas of the US where vaccine rates are low. And keep in mind that part of the problem that is being faced now in those parts of the country is that because the hospital systems are overwhelmed by COVID, people that have routine medical conditions, if you have a car accident, if you had a heart attack, if you wanted to have elective surgery, you may not be able to be served in the hospital because the hospital is overwhelmed with people who decided they didn't want to be vaccinated, and they're now filling up all the hospital beds. And so I will close at this point, and I will turn things back over to Dr. Mesh, and hopefully we can try, Dr. Amler and myself can try to address any questions that you might have. And I want to thank our colleague Marina Yogel for organizing this program and getting us together with you. So thank you very much. And I'll turn it back over to Dr. Mesh.
Yeah, Dr. Hewlett, that was an excellent overview. I really appreciated that. I hope the audience does as well. Very nice synthesis. So before we do have questions, but before I turn it over, Dr. Amler, did you want to make any comments or did you want to go right to questions?
I think the only comment I would make, and the most important thing for people to remember, is that when we look at the number of individuals who are hospitalized or who died from COVID, the vast majority of them are unvaccinated people. And so, that's the reason that we're spending our evening here with you to try to prevent that from happening to the people that take care of our most vulnerable children in the county. And the work you do is very, very important. We want you to continue to do that work, and you can't do that if you're ill. So it's really important work.
Uh, Thank you so much. Yes, so of the folks that are in the hospital that do die, it's an extremely high percentage that are not vaccinated, correct?
That is correct. The
Uh,
vast majority of people who die are
yeah.
not vaccinated.
Well into the 90%, right above,
Yeah, over
correct?
99%
That's
was
what I
the figure that
understood.
we've
Yeah,
seen.
99%. Terrific. So then, thank you for that. So there are several questions. Why don't we just go right to it? And I'll just report the questions as they were asked. Some of them are the topics you've gone over, but maybe you could respond to the specifics of the question. So one person asked or stated that it was this person's perception that the studies have shown that people who have had COVID in the past have developed antibodies that are up to 15 times more effective than a fully vaccinated person against COVID. If you have the antibodies, then why take the chance of getting sick from a vaccine?
Well,
Well, Dr. Hewlett is the expert, but I don't know where this person read that, but let's just point out that not everything you read is true. So, Dial, do you want to take that?
yes, sure. Again, I would be interested in seeing the citation that mentioned 15 times what you get from the vaccine. The data that we have reviewed that has been published seems to show that the vaccines actually offer protection that is 4 times to possibly even 10 times higher than what you get with natural infection. Now, it is true that after you have natural infection, you will develop antibodies. There's no question about that. And it is true that probably for the first 90 days or so after you have natural infection that you are protected. One of the problems, however, is that with the emergence of this new Delta variant, it is quite different than what we had with the wild strain. And if you were infected with the wild strain and the Delta variant is now coming into town, then you are certainly at a significant risk for developing infection. And one of the things that we actually know, this is not speculated, we actually know that the current vaccines will protect you against the Delta variant. But we would be very interested in reviewing the citation that actually states that you get 15 times the level of protection
So
from natural infection. So I'm not aware of that
well,
data.
I appreciate that. So the person that wrote the comment, if you would want to follow up with us by emailing either myself or Lana, or putting it in the Q&A if you want, we can follow up later. But
Yes.
What I'm hearing is that that is not true.
And
And
the immunity from natural disease wanes much faster. I mean, that's why we know
Mhm.
that, after about 90 days, we want you to be vaccinated because we do know that the immunity doesn't last. It's not like measles. People think it's like measles. You get measles, you're immune for life. And unfortunately, the coronaviruses don't work that way. Kind of like with influenza, you could have the flu every year, but you still have to be vaccinated because there's just so many variations of the flu, so many mutations that occur that it just does, you're not protected by simply having influenza. COVID is very similar.
And
so
the other part of this person's question, which we probably should address, which I think I neglected to answer, is getting sick from the vaccine. And I think that it is important for us, and unfortunately, I didn't include some of the information on the side effects of the vaccine, but with any vaccine, there are certain things that happen to us after we have the vaccine. And it is not at all uncommon for people after they've had the second dose, particularly, to feel a little bit tired, a little bit sluggish the day after. I think that it is important for everyone to know that what we see after getting the vaccine are very mild side effects that tend to be a very short duration. They may last for a few hours, and it is very unusual for people to have severe illness as a result of getting the vaccine. And so it's very, very rare to have people get very sick after having the vaccine.
I myself, the first dose I had, I couldn't even tell that I had had a vaccine. In fact, I was quite worried because I wanted to see something to say, hey, my body recognized this and it's doing something. The second dose that I got, I felt a little tired afterwards. Some people get a fever. They might even get chills. They might feel a little, just a little down in the mouth, so to speak, for a couple of days. But I can't remember any reports that have come to me of anyone with any lasting issues related to the vaccines in Westchester. I can't remember a single instance of anyone who had any real serious adverse outcome.
And what I'm also hearing from both of you is, after reviewing the literature, the scientific literature, that we're not aware of something like this. I just wanted to bring the point of information versus misinformation. And that's why I'm so happy to have medical professionals to have a conversation with us, because there's all kinds of information. And unfortunately, one of the outcomes of social media is anyone can report anything, whether it's based in fact or not, and then it can get amplified so quickly, and then it becomes something that might appear to be popular and true. But thank you for reviewing the medical research, so you can speak to the facts as we know them.
And the reality is that medical research, these have to be vetted, their findings have to be vetted, and they
Yes.
also look for other investigators to find similar findings. So just because a report may report one thing, unless others collaborated, the scientific community does not accept that. They want validation of what they're being told. On the internet, there's no validation. You can put anything you want on the internet. That
Right.
does not make it true.
So carefully evaluate the source of the information.
One other thing which we should add, and I think
Yes.
that this is a level of reassurance for people.
Yeah.
Many people are not aware of the fact that there is a system that's called the VAERS system. And this is a national database that collects side effect information from all of the centers, anyone who's administering the vaccine. If we are made aware, certainly here in Westchester County, we've administered over 60,000 doses of the vaccine. And anyone who has a side effect that's brought to our attention, we're obligated to file a report. And there have been millions and millions of people who have received this vaccine. And so the safety record is based upon the experience of millions and millions of people. Anytime you have a vaccine that's been given that often, you are going to have some people that are going to have issues, but it's relatively minor compared to all of the millions of people who have been vaccinated.
So what I'm hearing is that the approach of the scientific community is to separate fact from fiction. There's all kinds of reports about all kinds of things, and it is the purpose of the scientific community to separate the facts from fiction, so we can determine what is really true. And that's why things are vetted not only by the journals, but by additional studies, like Dr. Amler said, to see is it true or not.
Yep.
I'd like to go to the next question, which is, can you discuss transmission amongst those who are vaccinated and having breakthrough cases? If transmission is possible amongst vaccinated people, why does someone need to be vaccinated?
Because as we said earlier, your chances of ending up in the hospital or dead are substantially less if you are vaccinated. And that's the bottom line. I mean, every year people give me the same argument around influenza. And they're like, well, I got my flu shot and I still got the flu, but you didn't die of the flu. You're still here. And every year, a lot of people in this country, unfortunately, do die of flu. So the reason to get vaccinated is so you don't die. That's it. Bottom line, you don't die. And so, yes, some people who are vaccinated can go on to get COVID. And yes, but that group is small, very small. And yes, there are people who, who are vaccinated, who get COVID, who could spread it to others. But again, these are very low numbers, and the vast majority of them do not end up in the hospital and do not die. And that's the bottom line. I don't know,
So,
Donald, do you want to add anything to that?
Yes, I think you're absolutely correct. And I think that what we should do is think of where we were this time last year. We didn't have vaccines yet. And if you remember where the goalpost was planted, was we want something that's going to prevent death. We want something that's going to prevent hospitalization. And we want something that's going to prevent serious illness. And the vaccines have done that very, very well. All three of them have. Now, we know that some people do develop this mild illness that's like a cold, and we know that they are capable of transmitting infection. But the original purpose of the vaccines was to prevent death, hospitalization, and serious illness. And that is really the bottom line. And even if you look at those that develop the cold-like symptoms, that is very, very small compared to the overall numbers. And I believe it is well under 1% of people.
So what I'm hearing the answer to is, hey, I could take the vaccine and get COVID anyway. So what difference does it make? So what I'm hearing is that the symptoms are likely to be much less than if you didn't have the vaccine.
Yes.
And the
Exactly.
chance of you dying are dramatically less, even if you get a breakthrough case, than if you did not have a vaccine.
Yes.
All of that is true. In addition, you are much less likely to get sick in the first place.
Yes.
So it prevents disease, it prevents hospitalization,
Right.
and it generally prevents death. Now, nothing is 100% in life. I mean, that's just the way it is. But your chances are substantially better. And if you were a betting person, I think you'd want to bet on your chances on the odds that you get with the vaccine versus the odds you get without the vaccine.
Right. So
And
we
one
want.
other thing that we should keep in mind, and this is scientific data again, if you do get a breakthrough infection, the duration of your transmitting the infection to others is far shorter than if you were unvaccinated. And so let's think again about the people in our environment. So yes, it is possible if we have a breakthrough infection that we will transmit for a period of time, but the period of time during which we transmit is much shorter. And so the risk then to the people around us is much less than if we are unvaccinated.
And it isn't always just about ourselves. I mean, yes, I don't want to get sick. Yes, I don't want to be hospitalized. But I also don't want to give this disease to my elderly great aunt or a child, my granddaughter, who's too young to be vaccinated. And what if I give it to them and they develop serious disease or die? I would be responsible for that. I don't want that. So it isn't just about me. It's about everybody I care about. It's about everybody I'm around, whether it's at work or home or my friends or my family, or in your instance, the young children whose lives you have in your hands.
Great. More questions. One is, will there be a vaccine for children under 12, and will it be mandatory?
I can answer the first part. I'll leave the legislative part to Dr. Amler. We received news just yesterday from the manufacturer, the Pfizer BioNTech, that they are ahead of schedule in terms of submitting the data on children, that is children between the ages of 5 and 11. And they're going to submit their package of data probably by the end of October. And the FDA has vowed to work around the clock to review that data package. And it is possible that before the end of this year, we will have the emergency use authorization for the vaccine in children between the ages of 5 and 11. So that will be, that certainly was good news. And I'm certain that the professionals at the FDA and at the CDC, they're going to work as hard as they can to review all of that information and make sure that all of it is acceptable before they authorize the use in children.
Dal, do you want to talk about the fact that these vaccines now have full FDA approval?
Yes, the Pfizer vaccine was given full approval. And one of the things that we heard from people several months ago was, well, I'm going to wait until there's full FDA approval. I don't believe in this emergency use authorization stuff. Well, the Pfizer vaccine now has full FDA approval. And that was granted, I think, about 3 or 4 weeks ago. And so that is certainly a major milestone. And what we know is that the other 2 vaccines have also filed for the full approval, and that is probably going to be occurring very soon.
And as far as mandates, most diseases for which children can be impacted are mandated that you must have these vaccines before you could go to school. So I could well imagine that once we have vaccines for children that have full FDA approval, we'll probably see something similar happening. But we're a ways down the road from that yet.
Okay, another question. If someone has had COVID post-vaccination, is the booster still recommended when available?
Yes, absolutely. So people get confused between third doses and boosters. So right now, we are offering third doses to individuals who've had Moderna or Pfizer who have some underlying medical condition that might prevent them from obtaining full immunity with the first 2 doses. So people who have HIV, who have certain cancers that they're being treated for, some immunological conditions where their body has difficulty in mounting an immune response. So those are available now. So if you have a family member who has cancer and is undergoing chemotherapy, they can come into our clinic and we'll be happy to give them a third dose to help them increase the amount of antibodies that they currently have. The plan, the hope is that by the end of September, we will be offering boosters, and that would be a third dose to people that are currently immunologically, intact and hopefully fully vaccinated, and their immune system is currently fighting off this virus. That will come with recommendations around at what point from their second dose they should be vaccinated. Some individuals are thinking 6 months, some are thinking 8 months. And so it would be at a certain time that is yet to be established and given to us from the last dose. And that would only be for Moderna or Pfizer at this point in time. Johnson & Johnson has not yet indicated that they're going to provide a booster. People think that will happen. I know Dal maybe have more information on that. Dal, do you have any updates on that?
Well, the Johnson & Johnson, they actually have some data now that shows that for those individuals who receive a second dose, keep in mind that this was a one dose regimen. Those who receive the second dose have a significant boost in the amount of antibody that they produce. And so they are filing for that to be reviewed by the FDA. So we'll have to wait and see what the FDA actually says about that. So for right now, they don't have the authorization for another dose. But as soon as that data has been reviewed, and this is primarily for people that might have been immunocompromised who received the Johnson & Johnson, then they will actually have authorization to have a second dose following that.
There was another question about is the full approval for age 15 and up? Is that correct?
You're talking
For
about for the
Pfizer.
Pfizer dose?
For
Yes.
Pfizer?
Yes.
For-
Age 15 and up.
Yeah, actually, I think is it I think it's 16 and 16 and up.
16 and up.
16 and up. Yes,
It's
that's
16
still
16 and up.
approved. So there's still emergency use authorization for the 12 to 15.
12, 15. Okay, good. I'm just going to double check. I think we went through the questions. If folks have questions, put yours in the Q&A or chat. And then I would like to share my thinking, which is based on the conversation today and the facts presented and so on. The theme that I'm hearing is that the overwhelming evidence is that the vaccines are safe, effective, and that by taking the vaccines, the odds will be ever in our favor.
This is true. I mean, if you
Yes.
look at how many people have died in this country, it's hundreds of thousands of people who have died from COVID. You know, do you hear about people dying from the vaccine? No. But every day in our community, we hear people that we know who've died of COVID. And it's just incredibly sad.
So, Ms. Yogel, do you have thoughts that you wish to share or other questions that you wish that you may have heard from people that might need to be addressed before we wrap up?
I think pretty much, we've heard the same thing from providers who were concerned about, getting the vaccine. Much of it was shared in terms of the questions and some hesitancy around, wanting to provide a service where they were being forced or mandated to be vaccinated, those kinds of things. But I'm hopeful that after this discussion, some of those who still are concerned have been reassured how important it is to get vaccinated and keep those children that we serve who are also too young to receive vaccine, but also have developmental disabilities, that we need to really protect them to the best that we can by being vaccinated. So that's certainly what we should be considering. So it's pretty much the same theme that we're hearing.
So I would suggest that if people have questions that, they're not willing to ask today, that are preventing them from getting a vaccine, that they either ask their physician or that they reach out to us at the health department, and we'll be happy to try to get them an answer. I mean, there's no such thing as a question that, is too silly to ask. If it's keeping you from being vaccinated, we're happy to try to answer that question so that you can make an informed decision. And believe me, you're not going to get an answer on the internet that is scientifically based. So ask your doctor, ask somebody who really knows what the data is, what the studies are, what the science is behind the question. And, we're happy to help you with that.
I did have another question, and Dr. Hewlett, you did touch on this, but particularly in early childhood, we have a very high amount of female workers. And, some of the concerns that have come up is, women of childbearing age who wish to have children. What could happen? People hear different things. So if you could just respond to that one before we close.
Sure. I know we talked about sterility, and there's no evidence that sterility is caused by the vaccines. One of the things that people should keep in mind is that the organization known as the American College of Obstetrics and Gynecology, which essentially is, I guess you would say, a body of individuals who are primarily concerned about the health of women and during their pregnancies and during their deliveries. They have gone on record as recommending the COVID vaccines for women who are pregnant. They have recommended the COVID vaccines for women who are breastfeeding, and they feel that actually the vaccine offers significant protection, because if a woman develops COVID during pregnancy, she is at a higher risk for having serious complications than if she is not pregnant. And also a side benefit of getting vaccinated is that it will give some protection to her newborn if she receives the vaccine. So that's what we can really say about that issue. There's not really a concern at all. And there's been a lot of data that has shown that women who receive the vaccine during the trials where it was found that they were pregnant, there has been nothing found in the newborns that they had subsequently to show that there was any problem with those children who were born to mothers who had received the COVID vaccine.
And as a
And
pediatrician, I can tell you that, this is something we've done with other diseases where we want to make sure that the mothers are vaccinated so the baby gets passive immunity when you cannot yet vaccinate the infant for those diseases. It's one of the benefits of breastfeeding, is to be able to give your antibodies to your baby and protect them.
so, and do I understand right, with the millions of people who have received the shots, including pregnant women and women who have newborns and so forth, tremendous amount of data that we have not found negative effects. We found that the odds will be ever in our favor by having those pregnant women and women with newborns be vaccinated. Is that what I'm hearing?
That is correct. And just to go on to say that when we look at individuals women who developed COVID during pregnancy, a disproportionate number of those women who have bad things happen to them happen to be Latinx and African Americans. And so it certainly behooves women who are pregnant or who are thinking about pregnancy to have the vaccine.
And you're suggesting who have not been vaccinated, is that correct?
Right, that is correct. That is
Yeah.
correct. Yeah.
Certainly, if you're thinking of getting pregnant, it's the safest thing you could do for yourself, because just the state of being pregnant
Mhm.
kind of brings down your immune system, because if it didn't, your body would see the fetus as foreign and reject it. So, this is a normal part of being pregnant.
So I would like to bring us to close here. And once again, I just want to thank you so much, Assistant Commissioner Yogel, Commissioner Amler, and Dr. Hewlett for presenting the information tonight. It was very thorough, and we appreciate you sharing this and also allowing us to record the session, which we'll make available after. When people have questions after this presentation, Dr. Amler, who should they contact at the Department of Health?
That's a good question. Well, I'm happy to give you my email address if you have specific questions around this. And if I don't have the answers, I will direct them to the appropriate person. And my email address is A as in Apple, the number 5 at westchestergov.com. So if people have, just questions that they were not able to get answered, send them to me and we will get someone to give you an answer.
Great. Did you say SA5?
SAA5, 2 A's.
SAA5
at westchestergov.com.
Beautiful. Thank you so much. And thank you, Lana, for all the tech support.
No
Thank you so
problem.
much.
And we will include Dr. Amler's email in the email with the link of the recording.
And we would appreciate you completing just a very, very quick survey so we can get your impressions. Thank you again. Have a great night.
Thank you. Bye.